Vaccine passports, once hailed as the answer to the great unlocking in Israel, they are now, it would seem, coming to the UK. Health Secretary Sajid Javid has encouraged event organisers to require attendees to show so-called vaccine passports available through the NHS app. Some would say, including, I was just about to say including me, but no, not including me actually, because some would say it's a route back to freedom. Others would say, this is where it includes me, that it's very much an attack on freedom. And personally, if you wanted me to have one at your pub, I'd probably be going to the one next door. However, Israel have succeeded having the fastest vaccine rollout in the world earlier this year, but where passports, or green passes as they're called there, part of their success. I'm joined by Israeli health official Professor Gil Fire, the Deputy Director of the Tel Aviv Medical Center. Good evening to you, Professor. First of all, let me ask you, how effective was the Green Pass in Israel?
We think it was one of the most important measures that we used during our third wave of COVID-19, which was coincident with the beginning of the vaccination process. So we could differentiate between vaccinated people and unvaccinated people and let the vaccinated people come back to normal life quickly. Also, it was a very important measure to encourage the population to get vaccinated, and we think it was a success. We feel that it was part of the success, which actually for a period eliminated the COVID-19 from Israel.
Yeah, now let me ask you, what was the actual context for those not familiar with the green passes? You mentioned there about those people that were vaccinated. Did it just cover vaccination? For those people that hadn't yet been vaccinated or didn't want to be vaccinated, did it cover things like negative test results? Did it include double vaccines? What was the actual the scope of it?
It actually included only one thing: 14 days after the second dose of the vaccination. We use in Israel mostly the Pfizer vaccination, and when a person got his second dose, 14 days later, he could automatically get the Green Pass, the way we called it. And it was very easy to show it. You could show it on your mobile phone. You could show it as a certificate. And actually, it was checked on many occasions, like public events, like restaurants, like concert halls, and it was used very efficiently, very easily. There was some objection. There were people who were not vaccinated that said that they are discriminated by not letting them do activities that others could do. But this movement was very mild and didn't change the policy. It was very easy to use. It was enforced, but it wasn't enforced very strongly. And I cannot say that every place was very exact in checking it and not letting people get in. But the atmosphere was that you have to have it in order to be part of the activities that required it. And as a whole, it was a success. But it was cancelled when the situation improved much. And now in Israel we don't use it, but there are discussions, maybe with the Delta variant, to put it back only for big events, more than 100 people, but a decision was not made yet.
And what was the public reaction to this? I mean, you mentioned that there will be people that didn't have, for whatever reason, they didn't have their double vaccine. I mean, what is there, if you bring your Green Pass back, what happens to those people? Are they just excluded from those aspects of society?
So there were these voices, but they were not very prominent. And actually, as far as we started vaccinating many people and using the Green Pass, and the COVID-19 cases went down very rapidly, the people in Israel were very satisfied with this result. So there were these very voices of discrimination, of the right not to get the vaccine, but the vaccine was not forced. It was a right, but people wanted to protect themselves from those who were not vaccinated. So there was a public discussion. It was not, public discussions also in Israel can be very aggressive, very prominent in the press. This was not one of them. And as I said, it was quite a success. The response of the public was quite good.
And in your view, what is the likelihood of you bringing them back? I know you said you haven't yet made a decision, but do you imagine that you will, I don't know, in a month's time, have these green passes reinforced?
Well, we don't know yet because, now with the Delta variant, we all study it. We see an increase in the number of cases in Israel, and about 2/3 of the new cases are among people vaccinated. So we understand there is an issue here. The disease seems to be milder than it was before, and the number of patients that need hospitalization or are in a very severe condition is quite low for the time being. And we believe that we will have to live with the corona for a long time. If we had a fantasy of eradicating it and forgetting it, it will not happen. So the measures we will have to take will be different than the measures that we took before. And the policy of the Prime Minister now, of the government, and also of the professional people, are that we have to take new measures and not to use radical measures like we used before. So we try now other measures like the very fast examinations as a measure to let people that are not vaccinated get into places. And we study it now. I'm not sure that we will use the Green Pass again. It depends on the behavior of the disease, how many people will be infected and how many difficult, severe cases we'll have. And the decisions will be made according to this follow-up that we do very systematically.
Okay, Professor Fire, interesting to hear your experience there in Israel. Thank you very much for joining me.
Welcome to the GB News YouTube channel. You can watch us live 24 hours a day, catch up on your favourite shows, and join in the conversation in the comments below.
Don't forget to subscribe and you'll never miss any of our exclusive content.